Hello friends, in the 10th week we are going to talk about some social, spiritual and community support in palliative care. In this week we will talk about human and communal dimensions beyond physical treatment, and main focus will be community participation in healthcare. How community is helpful in your health management. That part is very important. Building formal and informal support system, using digital tools and emotional support for your patients. Family and community role in recovery of the patient symptoms, patient quality of life, and spiritual wellness and cultural sensitivity. Community participation in health, engaging ASHA workers, local leaders, and volunteers in your patient's healthcare by connecting your patient with the wellness centers, with the primary health centers, with the community health center. This is very important. We are going to talk about how to use your knowledge, your awareness, and bring awareness in the family of the patients for using these facilities. They also arrange some training programs, periodical screening program. Your patient and their family members should attend those services which are being given free of cost by the government. That we are going to talk. Bridging a clinical care and spiritual and emotional need of the patients, that we are going to talk. And creating community-based care network for the patient is the main focus. The social support system, we are going to talk about formal support like hospitals, NGOs, health departments, how their services can be utilized for your patient. Informal support like family, neighbors, spiritual groups, that local area, how they can be helpful in your patient care, that will be discussed. Mapping support from individual to institutional level is our main objective. The case studies and emotional support, like the digital tools to reduce the isolation, home-based care with emotional and peer support, role of telehealth and virtual common companionship will be discussed. Family and community role is also very important. We are going to talk about that. The caregiver education and empowerment for giving best services to the patients, reducing the hospital visit and enhancing the dignity of the patient, and integrating local cultural practices will be discussed in this. More specifically, another patient is the Alzheimer's disease. Mostly the Alzheimer's disease have their cognitive decline, they have the dementia, they are in different grades, grade 1, grade 2, grade 3, grade 4. So in which grade the patient is, accordingly management has to be planned. So we are going to talk in detail about the Alzheimer's disease and their symptoms and their management. And the next lecture is the healthcare systems, which is already in practice in India by the government. That part, the awareness about those systems to all of you will help. That way we are going to talk. And the existing healthcare support system in India, community participation in health, understanding the social support in healthcare, social connectivity, case studies, family and community role in recovery. These are the topics which we are going to talk about. So let us begin with the 10th week of learning and teaching in this 12-week palliative course. Thank you. Thank you very much.